Today, the Biden administration announced some positive news that we do expect to hit that 100 million doses of the vaccine in the first 100 days early, and they expect that to happen tomorrow. I spoke with an infectious disease expert from Ohio Health earlier about the vaccine rollout to date and also concerns about some other variants of the virus and spring break travel. Here's part of our conversation. CDC did release some new data suggesting that 31 states are falling short of getting the vaccine into people's arms. From where you sit, what can be done to address this issue right now?
A lot of things can be done. First of all, we have to take the vaccine safety and efficacy message to all communities. There is a lot of vaccine hesitancy out there, and we really need to engage all people and all zip codes in a non-judgmental, respectful manner. These vaccines are very safe and they are very effective in keeping people out of the hospital and keeping people from dying. We need to take that message to all zip codes. Remember, COVID anywhere is a threat everywhere.
I understand you have said infrastructure is really critical in making sure that we get the vaccine distributed in a timely manner. Can you give us some examples of what has worked in Ohio with your health system in order to reach that mission?
Yeah, a couple of things. When it comes to making the vaccine easy for people to schedule, we have to recognize that we are reaching all people. Not everybody can access the internet. Not everybody has a smartphone. There are some people who don't even have telephone access. So we really have to figure out how people can get connected to getting scheduled, whether it be online, calling, or any other venue. At Ohio Health, we have repurposed how we deliver health care in underserved communities. We have trucks that have been repurposed to actually take vaccines to underserved communities to distribute vaccines into people's arms.
Good to know. I'd love for you to address what we're seeing in Europe right now in terms of infections. Some schools and businesses have been forced to close as a result of another wave. Are you concerned at all that something similar could happen here, certainly as states relax some of the restrictions and people start to travel more for spring break?
Absolutely. The pandemic is not over in our country. Yes, positivity numbers and hospitalizations are down, but it's not a reason to celebrate. Our positivity numbers as a country have really plateaued since mid-February. We're still averaging above 50,000 new cases a day. That's still way too high, and it's really the level where we were last summer when we had our summer surge. Deaths have come down too. We're still averaging above 1,000 deaths a day still. The recommendation from the CDC still is to avoid non-essential travel. If you travel, try to get vaccinated before you travel, but you still have to follow the mitigation practices that are out there. Avoid large crowds, and regardless of your vaccination status, you still need to wear a mask in public.
What is your message on these new variants that we have seen that are more contagious, certainly in Europe, moving forward in the coming months? What would be your message?
We need to collect data. We need to study them. However, the predominant variant is known to be sensitive to the vaccines, meaning that the vaccines that we have from Pfizer, Moderna, and Johnson & Johnson give a great immune response to this variant that we're expecting to see predominate in our country. And guess what? Both the mRNA vaccines and the Johnson & Johnson vaccines can be changed quite easily to cover these variants. In fact, Moderna has already tweaked their vaccine to incorporate the South African variant, and they're studying that now in South Africa. What's happening more and more as more people get vaccinated, instead of the CDC telling us what we can't do, there are more signals coming in from the CDC of what we can do once we are fully vaccinated. We want to think about ways to kind of encourage people to get vaccinated, and that's a good message to take to people.
We'll see by the time we get to July 4th if everyone's able to gather safely with their loved ones. That appears to be the goal. Dr. Gastaldo with Ohio Health, thank you for your time.
Thank you.
Some positive news. Not out of the woods,
right.
Positive news.
And that July 4th is a nice mental benchmark.
Put it on the calendar,
yeah,
right? We can get there.